Hi, I'm Dr. Philip Macmillan. Thank you for joining me as we continue the journey of scientific discovery and exploration. Since early 2020, I have been speaking with scientists, doctors, researchers from all over the world to try and understand better what they are doing, what they are seeing, and most importantly, what we can learn. It's important to recognize that COVID does seem as if it's here to stay, and the longer term implications are becoming more and more complex for us to deliver and to deal with. And so, therefore, getting ideas from different people across the world is critical. And so, what I'm doing today is that I have here Dr. Kadri. And how do I pronounce your first name again?
It's Laiqha
Leah,
Khadri.
Leah. Gosh, that's gonna be so hard. Forgive me if I get it wrong. But do you mind introducing yourself to our audience?
Yes, sure. Hello, hi. I'm Dr. Laiqha Khadri. I belong to Bangalore, Karnataka, basically from India. So I've been from past 2 decades into biotechnology field. So I was teaching in the master biotech students, and I was handling projects, and I have worked a lot into the cancer uh, field. So the diabetes and cancer field was my basic research topics. And in 2018, I was working on effect of metformin on cancer cells. And most of the natural anti-cancer compounds also I have worked on, like garcinol is PGCG. So the flavanols. And when the COVID hit in 2019, I was fascinated, having the effect of this inflammatory disease onto the cancer patients and diabetic patients also. So I was more fascinated to learn more about this and put it into my clinical practice and help people understand how to manage the COVID symptoms and the post-COVID symptoms.
Excellent, excellent. Now, listen, there was something you said there that caught my attention. Metformin and cancer. And for people who don't know, metformin is one of our very important diabetic drugs. It's been with us for decades. It's maybe even coming up to 100 years. A very, very versatile drug. What is the connection with regards to cancer that you are finding?
Metformin is, it is a GLP-1 blocker. I mean, it is used in diabetic patients for many years. It was going through clinical trials in India somewhere around a decade back. So some of my family members also were into this clinical trials. So I just found the metformin also could be helpful in treating cancer cells. So I just got uh, curious about finding out how metformin can be used. So I included this into my practice, and I did a project along with my students. So while doing so, we found it has a lot of inhibitory effect on cancer cells.
Wow.
So I just finished this project, and I also have submitted for my MPhil, Master of Philosophy. Then I got my MPhil through this project, and my students also continued doing research on this, uh, the metformin effect on cancer cells. So we have used some, 3, 4 cell lines. So in vitro studies we have done, and clinical one we were doing in 2018. So then I focused my attention on COVID when
when
when it hit
COVID
in
came
India.
along. It's
Yes.
an interesting point there you made. It's that
Mhm.
COVID, I realize, for because as a doctor, you didn't have to focus on it. It was just one of these things that you could have waited for protocol. So the experts could have looked at it, they would have then come up with a protocol, and they would say, here, this is what you do. Then for some people, they wanted to be independently researching COVID and understanding it for themselves. What made you do that?
When I just observed the people who started developing symptoms of COVID, then I thought these symptoms are already, phased through. They already the patients are going through. It is just a little exacerbation of the already present symptoms. So, if there was a pulmonary infection and if there is asthma, COPD patients, they also face the same symptoms, but it was in a severe manner. So I got curious and inquisitive into finding out what was the reason. So then, there were a lot of reasons through these years, I have found there are a lot of reasons. So one of the reasons may be airborne infections, and most of the time, the patients develop severe symptoms because of their inner inflammatory markers. So inner inflammatory markers, the blood markers are more important, to diagnose a patient of developing severe symptoms than finding out what was the cause. I mean, more than the cause. So the inner biomarkers are basically important find to diagnose a patient whether they develop a severe disease or it may be a manageable disease. So this
Yeah,
is
I think
what
that
made me curious to find.
Yeah, I think that I usually describe COVID as spraying petrol on the embers of inflammation, meaning that
Yes.
the people who get really sick are the ones who have pre-existing inflammation. Sometimes they weren't aware of it, and this pre-existing inflammation then flares up in the context
Yes.
of COVID, and it can cause either severe disease or multiple long term issues for some people. And it's very difficult for people to acknowledge, especially if they were relatively well beforehand. And but it is the reality of what we have seen. Now you are in India. You guys were hit with the beast of the wave with Delta. What was that like? And did it personally impact you?
Yes, I think most of families have one of the members suffering from severe uh, symptoms, and uh, death was very common in most of the families. So we have seen many cases of severe hospitalizations, and death was very common during the Delta variant. So I have personally lost my mother-in-law for during the period, the 2021, the 20 yeah 21 hit. So we could see we could see every family having death case.
Yeah.
So in Bangalore also we have seen. I mean, we could not imagine that we have never seen this before. So it was very disturbing, and we really came to know that, and we really experienced a lot of trauma during that time. So people who denied COVID also, uh, have to come to terms that there was some, severe thing coming. The severe waves are going on, and those things.
I have a feeling that the population has been so traumatized by what has happened that people almost want to move on and say that was in the past, and then you have another cohort who say that it wasn't real, it was just an imagine, it was made up numbers, it was flu in disguise. And I want to caution people that no, this was nothing like what we had ever seen before. I have never lost a colleague to flu. I've never had colleagues ending up in hospital because of the flu. This was just at a completely different level. And as traumatic as it is, I think it's important for us not to underestimate the implications of ongoing circulation of the virus. And this fundamentally is what you are doing. This is why, in your practice, you are trying to help people in that journey. What generally are you seeing? Because a lot of people, including myself, kept thinking that India was just not as seriously if affected with some of these longer term symptoms as the Western world. Is that a correct perception?
Uh, to say that we are not affected is a very, undermining term. So we are affected. We all we see patients having brain fog and certain symptoms where they are suffering every day and their daily life is being disturbed. And but here the procedure is not defined as post-COVID or PAS, such thing, because there are many approaches. People find the traditional approach, the Ayurvedic, and uh, you know uh, other non-conventional approaches where the people are managing their symptoms. So basically, here there is a symptomatic treatment. So they don't define it as post-COVID or PSC. Otherwise, they are suffering from symptoms.
Yeah, it's one of the things is that I have found that the concept of long COVID is, or PASCS, past post acute sequelae of COVID, is not something that people like to have as a diagnosis. One, and many people will just say that all of these long term symptoms are vaccine related injuries, forgetting that a lot of people were suffering from it even before vaccines became available. No doubt that there is some blending of the symptoms, but this is a very complex condition. When you say that people don't even know that they have it, how do they how do they feel when you start talking about the fact that they're struggling with symptoms is still related to COVID? What is it that you get as a response?
Yes, the patients or the people who are coming in, they do not want to, they are not comfortable listening to it as post-COVID. So we have to be very, tricky in making them understand that they are suffering from post-COVID symptoms. And because there is not much awareness about how to manage, the explaining them is a very tedious process. So basically, the awareness and education, I say always, is important. So once the patient knows how to manage the symptoms, they accept it. They understand and then they accept it. If they are not aware and they do not know how to manage, it is difficult for them to, make them understand and, tell them that it is the post-COVID symptoms they are suffering from. So if they know how to manage, they accept it and they understand and they, try to manage.
Yes, I think that when I reflect carefully on where things are at the moment, because everybody wants to move on from COVID, anything that could be related to COVID, especially as a disease pathology symptoms, is just not what they want to hear. I'm not sure if there's any easy way to get around this, because I describe what I call the COVID storm, the spike triggered, where you're having ongoing pathology because of ongoing exposure to spike protein. I know for most of the world, because nobody is getting boosted as much, this is all related to the variants. And my concern has always been that if you have an immune system that is already primed, what happens when there is another infection? How does it respond? If it, does it go into overdrive? Is that the manifestation that you are seeing now, almost that inflammatory process now on some degree of steroids, not like severe COVID, but just running away? What are your thoughts?
If the patients are, they have an infection and it is not completely managed, treated, let me say. So the treatment has to be completely, it has to stabilize the body of the patient. If they are unstabilized and it is not treated thoroughly, and then they get a secondary infection, of course they will have storms, and it will be a severe condition for the patient. So whenever they get an infection of any variant, treatment and its complete cure, or when we say cure and healing, it is a different process again, because it depends on what is the disease history of that particular patient. So if the patient has a very severe disease history and they get a infection, the first infection itself will be very severe, and the cure and healing process will take a very long time for these kind of patients. And if they come out very well out of this infection, and they heal thoroughly, the secondary infections will be mild. I mean, they develop mild symptoms, and they can activate their own innate natural immune system. They are able to ward off, or they are able to fight off that infection very uh,
Yes, I noticed.
properly.
Yes, I noticed that one of your recent posts, because I know her, I know from LinkedIn, was focused on the intestines and the lymphatics. A very interesting point that I don't even know if people understand when they think of the lymphatics. I brought up this image here that you had shown, and here you have the intestine absorbing usually fats, going into these lymphatics and then up to the lymph node, and then eventually getting into the bloodstream. What made you focus on these lymphatics as being part of this whole long-term chronic symptom process?
Uh, Actually, when we say the blood biomarkers or causes severe cytokine storms, so the blood biomarkers are related to somehow it is related to the microbiota of our intestine. So the good bacteria and the bad bacteria dysbiosis in the gut. So it has a profound effect on the nutritional absorption, the blood composition, and most of the blood biomarkers uh, uh, composition are related to the bacteria present in our gut. So the microbiota has a very, very profound effect on the health of an individual. So it was very interesting to find out that the microbiota has an effect on nutritional absorption, the mitochondrial health, and also the immune system. So our immune system is directly related to how our gut microbiota is designed, and the integrity of the gut lining is also dependent on the microbiota which is present in our gut. So the lacteals are the openings of the lymphatics, which are connected to the small intestine. So small intestine has all the nutrients which gets absorbed through these lacteals. So most of it are the lipids. So these lipids and the microbiota, the LPS, enters through the lymphatic. The lacteals has the zipper and the opening. So we can see the makeup of the lacteals is such that it allows the lipids to get absorbed and then move into the LPS, and the lipids absorb and move into the lymphatics and enter into the lymph nodes. And if these lacteals are not working and they are not, they're the design is not uh, at particular level, they dysfunction, they become dysfunctional due to inflammation or certain infections. The absorption of the lipids, it is called as chylomicrons. So these lipids gets they're not absorbed properly, and then there is dysbiosis in uh, identification of the LPS of the bad bacteria present in the microbiota for that region. So
And
all this has an effect on the immune system of an individual, how the immune system works. So the gut bacteria also, it has a effect on the gut lining, the integrity, and the immune system and the mitochondrial health. So I found that this was an important topic to be picked up, and it is a basic. I found this is a root cause, you can say somehow, for uh, you know uh, diagnosing people, or how they will behave. I mean, how they will take up the disease and how they will process it. The antigens. So they are exposed to so many antigens around.
yeah, so
So the
one of the
processing of
things,
these antigens are dependent on the microbiota and the gut.
yeah, one of the things that I remember when I was looking at the lymphatics, and I've been looking at it now on and off for a number of years. And the biggest challenge I had was that there is so little research into it, certainly post COVID. So we do all kinds of other research, but we haven't done any kind of detailed, thorough look at what happens to the lymphatic system in the COVID or even the post COVID period. Because one of the things when you think of diseases like a lymphoma, especially when you think of fatigue, one of the characteristics of lymphoma is that it has the most profound fatigue that people can have, which can be very similar to many people after they have had even a mild infection. So I had always wondered whether or not lymphatic inflammation is central to the pathology around the post-COVID symptoms. The problem is that we don't have any radiology. It's very difficult to look at them, and so there is not a lot of radiological information. The closest I've seen is this thing that did happen with mRNA vaccines and hypermetabolic lymphadenopathy, but that's the closest we've come. We don't really know what is going on in the lymphatic system. We can presume it, and I think you're right that this is an important part of that picture. Hmm.
Can we just cut it off?
Yeah.
Uh, I think we have got some little sound disturbance.
Well, this is just beyond Eid, isn't it?
Yes, yes, that's true.
And so, well, you can explain to us what that is about. Well, we may as well know. Is it somebody who is singing?
No, it's it's a call for prayer. It's we have 5 times to be prayed. Every day we
Oh,
pray 5 times. Yeah, it's a
and
call for
so
prayer.
It's a call for prayer. So just curiously, since we kind of had this tangent, the call for prayers now, people would be expected to pray in what kind of time frame?
So it's basically five times. It's in the morning sunrise and afternoon and in the evening by just before sunset,
Yes.
one during the sunset, and in the night. It's
One in
around
the
somewhere around 8:30. It depends on the sun rays and sunset timings in different parts of the world. So right now here we have it's
so that's
sunset time.
useful to know because as I said it's important to know from a cultural point of view that this is an important aspect of the daily life in
Yes,
that. And so this is the a Muslim part of Bangalore, I'm assuming.
right.
Yes. So yes, so as best as we can, will they do that for a long period of time?
No, it's a very short time period we pray. I mean, it's only a 5 minutes, process. So uh, we just after the call we have a 5 minutes of break and we just go finish our prayers and we carry on with our whatever ongoing.
Excellent, excellent. Well, what I'll do is, while we're thinking about that, is that I will show you another image that you had. What was this here about?
So it's effect of so this is how microbiome
Oops, you just broke up a little bit. I didn't hear that.
as in one second. Yeah,
Can you see it okay?
you're okay. I think we can. Yeah. So this is how there is an effect of inflammation caused in the gut lining, in the gut region due to dysbiosis of microbiota, and the you know the gut lung axis, the gut liver axis, how it has a effect on the different parts of our body, and
And
how the
so,
inflammation caused in the gut has an effect on
on the whole thing, and you focus
in lungs, liver,
yes, and you focus a lot on these bradykinin receptors as being part of that inflammatory process, heart,
process,
lungs, muscles, brain.
muscles.
And this is
So
and
it's
this is not
basically
just go on.
it's basically due to the inflammation and the mitochondrial dysfunctioning. So it leads to most of this fibromyalgia and vasodilation. So this inflammation caused has different effects on the liver, lungs, kidney, and the heart.
Hmm. Yeah, so this is so, and one of the problems is that a lot of these changes here are quite silent, meaning that patients don't necessarily know that this is occurring, and it's not until down the line that they start having symptoms. Is there any easy way to identify people who are having subclinical or even well, you call it asymptomatic, where they don't have any obvious symptoms but these patterns are relevant?
Uh, if the patients are going for a routine blood checkup, so the patients are always, uh, you know, the doctors prescribe for the blood test. So if they are going for a routine blood checkup, so they can check up for the vitamin D, the nutritional aspects, the TMAO, and uh, the inflammatory markers like CRPs. The CRPs are one of the silent markers which can identify, which can give an idea of whether the patients may suffer from severe symptoms.
Yeah, so any
It's one
kind
of the
of
factors.
yeah, any kind of inflammation is usually picked up and been able to be seen. Before we tie things up, I wanted to catch this third image that we had that we'd looked at. Is this one here? Is you looking at the increased coagulation patterns where people, this is fitting in with the microclotting that a lot of people are
Yes.
suffering from. It's a complicated picture, but it's is there, what is the essence of it?
So I just have put a lot of posts on DVT, the deep vein thrombosis, and pulmonary embolism, and this P DVT are so much connected. So it also I was very curious to know how the deep vein thrombosis and the pulmonary embolism are deeply connected, and how it has an effect on the COVID symptom severity. And uh, the lower limb, thrombosis, the limb thrombosis, and the PE are so much, you know, they are related, and it is very interesting to know how the DVT, the deep vein thrombosis, this hypercoagulability, and different parts of the body has an effect on pulmonary embolism and development of the COVID symptoms, and also atherosclerosis and arteriosclerosis. So these
And
are
at the center here, you have your COVID virus driving
yes,
all of these symptoms, and these are just reinfections, aren't they?
yes, these are the pre-existing markers, so which decides the severity of how the infection will manifest. So these are the DVT, the hypercoagulability, and the fibromyalgias. These are the pre-existing symptoms in the patients, the undiagnosed symptoms, which may decide, which may have a prognostic effect on the infections. How the SARS-CoV-2 infection will manifest in a patient, whether they will be hospitalized, whether it is manageable, or whether it is treatable. So uh, these particular markers within the human body will give a clear picture on how the patient will respond to the infection.
Yeah,
Yeah,
yes.
these are the
So
markers.
yeah, so I think that it is clear, as I said, that you are seeing that reality playing out in terms of real world stuff, in terms of the patients that you see. But you do more work than just patients on the ground in India. You also reach out to people to try and help them even at a distance. What is it that you are looking at there?
So I have this, online consultancy by the name Immune Inspired. I have registered in Bangalore. So, the patients who are any individual or patients who want any queries or questions to be cleared, they can contact me and have their, questions cleared about how to manage COVID symptoms and post-COVID symptoms and PACs, and if any queries they have regarding nutritional approach, or regarding how they can manage their IBDs. So most of the patients who have suffered from COVID infections have developed IBDs and IBS, and gut related issues. So how to manage through nutritional approach is one of the major you know uh, I deal with the consult. consulting the patients.
Here's an interesting question because you are coming out of a pharma background, working with drugs and so on. What, therefore, do you think? Why would you step away from using conventional drugs and prescriptions and shift more to a nutritional approach? Is it that it's likely to be broader and more effective?
Uh, Pharmaceutical approach is good in patients who have very high loads of infections. So we have been, we have known this antimicrobial resistance individuals, antibiotic resistant individuals. So these patients who are, who don't require antibiotics and any other medicines, they can manage their symptoms through nutrition. So they everybody don't require to have uh, prescribed drugs. So we have to identify those individuals who are AMR and who are who have less um, microbial loads. Their gut. So basically, it is the gut microbiota which decides so how the individual will respond to the drugs or the nutrition, whether they require drugs or whether they don't not require, they can manage their symptoms through nutrition. So how to identify, one of the factors is identifying the granulocytes. So blood test is important for all the patients, I believe, because identifying the content, the amount of neutrophils in their blood gives a clear picture of how they will respond to uh, the treatment. The treatment may be a nutritional treatment or it may be a drug related treatment. You can prescribe drugs only if the patients are having a very dysbiotic gut microbiota. So these kind of patients may require antibiotics, some may not require, some may require only anti-inflammatory, and most of them may require only nutrient, dietary patterns changed for maintaining their symptoms. So just by seeing the sorry, the granulocyte contents in their blood, the doctors may decide, and the inflammatory markers, of course, the doctors may decide how whether. So I just, for me, the blood report gives a clear picture, mostly whether they require a nutritional approach, a drug approach, or any other related.
That's really important. Yes, thank you.
Yeah.
That's important to be able to differentiate because there is so much complexity around what
Mhm.
is going on. And I think what's important is that there are clinicians who are working in this space, trying to find solutions in this space, and therefore giving patients options. And especially the point about nutritional stuff, I think people underestimate what that means because you are technically addressing without disturbing the microbiome. It's a really
Yes.
subtle balance because if you do too many changes to the microbiome, that can cause as much illness and problems down the line. So as we close out, what would you like to say as a final word to our audience? And remember, she's saying immune inspired is her website. Is that the name of the website?
Yes.
Immuneinspired.com.
So yes,
Yeah.
immuneinspired.com. So I just want to say that immunity is can be helpful for any individual, and then it also can be very dangerous for certain individuals who are already having cytokine storm. Their immune systems, immunity is not. It is not something to be to be boasted. I mean, everybody says you have to boost your immune system. sometimes immune system boosting also has a adverse effect. So you have to have a balance of everything. So the gut microbiota also, it has to have a balance of the good bacteria, bad bacteria. So you cannot just remove all the bacteria and remove all bad bacteria and have only good bacteria. So it is always a balance, and the immune system also, it has to have a balance. When you activate an immune system, so your body has to have a balancing mechanism where it can uh, reduce this immune activation. So it has to have a check on the immune system, and then it has to balance it. So the nutritional balance, the immunity balance, and the energy balance is always is better for the well-being of an individual. So immunity boosting is good for people who have lower immunity. So people who have a very high-end immunity, they have their interferons and those at a higher level, and boosting immunity will have an adverse effect in them. So, so there are so many aspects where we have to be very careful in boosting or reducing the immune system or anti-inflammatory markers. And so anti-inflammatory is also not it is not a universal better treatment, or antibiotic is not a universal treatment. So every individual has their own level of they are going through their own health levels. I mean, they are at different levels of sickness, or they are different levels of health in their stages. So identifying that particular stage of an individual is very important. So every individual will have their own health status, or a sickness, or the disease status. So we have to find out which status they are in. So just generalizing everybody that they are in a level state, I mean, particular sickness or a particular health status is wrong. I mean, every individual has their own, status of health or sickness. So identifying that and then giving them a treatment, or giving a procedure to manage symptoms is very important. So this is what I.
Excellent. Yes, I agree with you completely. Yes, it is very complex. And I see very often people are just thinking that you boost immunity. It's not about that. So some people you need to actually take down their immune responses, because that's what's driving their disease. So thank you very much. And really appreciate your insights. Appreciate
Thank
anyone
you.
who remember immuneinspire.com if you want to find out more information and understand a little bit more about what Dr. Kadri is doing. Thank you, and stay with me for the outro, and have a great evening.
Thank you. Thank you. Thank you all.
Yeah.